I'm Dr. John.
And I'm Dr. Chloe Costigan.
We've created a challenge for you based off of all of our patients, our background, to improve your arches in your feet. We chose these exercises specifically to reform and reshape your arches and the fact that they've fallen.
The primer consists of 3 different exercises, 1 to improve flexibility, 1 to improve stability, and 1 to improve strength.
That's right, and you're going to treat it like a circuit, and we're going to have a before and after test, so that way you can measure your progress over the next 4 weeks. You can fit these exercises in at any part of your day. The most important part is your consistency.
One important point that John had made about relearning how your arch is positioned is that so much of these exercises are about doing them, but then also really thinking about the position that your arch is in, because you need to actually send a different message to your brain to get it to be able to integrate all of that work that you've done. So this isn't really something that you can exactly do mindlessly. You have to be pretty focused on what it is you're doing.
It's something that is partly under your conscious control, but then you need it to be part of your subconscious. And if you're not being mindful with it in the beginning, you're not going to get very far.
Right, you have a lot of repetition of walking the same way where your arch is falling every single time you take a step. So just doing a few exercises isn't going to make a change. You have to kind of really think about just moving in a different way, which is really hard.
And the strength exercise that we chose as part of the primer is actually an exercise that I believe often gets missed, because there's a lot of focus on tib raising, but spoiler alert, does not actually improve your arch. It's part of the arch. It's not targeting the most important muscle that is helping your arch to stay upright. All you're gonna need for this primer is a ball to roll the bottom of your foot, and you're gonna need some kind of band for the strengthening exercise. Want to show them one more time? What's the ball?
Ball, band.
That's right.
And somewhere to sit.
Yeah, and you could use any ball or band that you want. We tend to like a ball that vibrates, like the Hyperice Minisphere, and then literally any band will do. You just need enough resistance for the exercise, but don't go overkill. You're gonna do 15 reps on each side, so it's gonna be tiring. Should we get into it?
Let's get into it. To test the efficacy of the primer, we are going to do a pre-test and a post-test. We are going to do a sit-to-stand test where we're focusing on what the arch looks like.
So I'm just going to start seated, because when you're seated and you're not weight bearing, then your arch should reform, especially if you have flexible, flat feet.
Which John has.
I do, I have that. I found out. It's my confession.
I've told him that, by the way, already.
Probably.
Yeah.
I didn't listen. If you have rigid, flat feet, you might not see as much of a change here, but that doesn't mean you can't do the primer, and that doesn't mean you won't see as much change later on. But in this moment, maybe it might not be as obvious. But for me, what we're paying attention to is the shape of my foot, and when I stand, I'm going to see it drop. And I'm not trying to make it drop, but obviously I'm calling attention to it right now. So I'm going to sit. I'm going to stand. And you're going to do that 3 times just to get a sense of how your feet are moving, and in my case, just naturally falling. I could pick them back up, but what we're looking for is for that to be more natural and automatic. So 3 times in the beginning, and then we'll repeat it 3 times in the end. And obviously, you're paying attention to both feet.
Right, you want to take a look at what the left side's like versus the right side, because you might find actually that your one side will drop a little bit more than the other, or one side doesn't drop at all and then the other one does a little. That's one of the things that we're looking out for, are asymmetries.
For the very first exercise, you're going to use a ball. We're using the Hyperice Minisphere. We like this in particular because it also has vibration to it. It's not the end of the world if yours doesn't, but you can get a little more bang for your buck using vibration.
2 for 1. Ideally, you do this sitting, because then you can have a little bit more control. You're not necessarily having to focus on what your balance is like. So John is going to start by rolling through the bottom of his foot, getting this lateral arch, the transverse arch, and that medial arch. If you have no idea what I'm talking about, make sure to watch my anatomy lesson. Okay, so John is slowly going through in a vertical fashion first, to try to help to get those those fibers of the plantar fascia, but then also the intrinsic foot muscles to kind of loosen up. This will also actually help some of the tendons of the bigger muscles that are up in the lower leg. So he's going forward and back, and then also side to side. One of the biggest mistakes that I see with someone rolling the bottom of their foot is they're just kind of moving back and forth in a kind of haphazard way. Remember, with flexibility exercises, we're trying to realign the orientation of the muscle fibers. So you want to be deliberate in how you do that. If you find a spot that feels a little bit tighter, you can hang out there a little bit, but what I would suggest is you have 30 seconds to do this. So make sure that you scan through that whole area and don't just focus on the areas that are most painful or kind of uncomfortable. As you continue through the 3 rounds, then you can start to focus a little bit more on one area.
It's just that simple. Obviously, I'm trying to reform our arch here. You'll see it should look like your arch is forming just by virtue of the fact that you have the ball underneath there, and the vibration's doing a good job of not only tickling me, but increasing blood flow and circulation and like breaking up those knots. We're gonna do how long on each side?
You're gonna do 30 seconds on each foot.
Yep, and if you spend a little more time on that, it's not the end of the world, but a minimum of 30 seconds is ideal. And remember, we're gonna be getting 3 rounds of this circuit in, so you'll have 3 opportunities or at least a minute and a half on each foot spent. So on to the second exercise.
This one is a favorite. This is arch doming. So this is what I was talking about in terms of retraining how your foot moves. This one is so important to be really deliberate about what it is that you're doing, because you're not only strengthening your arch in that position, but you're creating that pathway to your brain telling it that this is the ideal position it should be in at all moments, not just when you're doing this exercise.
So you gotta be consciously aware of what you're doing, so that way it could become a subconscious movement or a subconscious position for your body. So walk me through this.
Okay, so you're gonna stand facing me. We're going to focus on improving our arch in a weight-bearing position. So this is really important. I'm gonna be really picky about this. I was already picky about this.
This sounds like fun.
So if John is doing the arch domes for his right foot, he's going to bear weight on both sides, and then he's gonna step his left foot back. So then he's still bearing weight on this side. Okay, so here he is trying to balance a little bit. If you need some support, that's fine. But now his weight is here. It's not the same thing if you just step your right leg forward, because that's not actually how you bear weight and that real positioning that your arch needs to be in when you're walking. Okay, so what John's gonna do is he feels the pressure in his foot. So he feels it through his heel, big toe, and pinky edge side of your foot. Can you confirm that?
I can confirm that.
Okay, so now what John's gonna try to do is he's gonna try to press to the heel, press to the big toe and the pinky edge side of the foot as he lifts up that arch. His toes are going to want to curl. That's not ideal, right? Because what he's doing is he's actually overusing some of the other muscles that are kind of help with the arch, but they're not actually like the main players.
Right, but just to jump in, what I found though is helpful is for myself, and you might find this because it's difficult, especially if you are a flexible, flat person like myself, that if I do go into this position and I'm gripping too hard, it's actually easier for me sometimes to then work backwards and relax my foot as I'm in that position.
Yeah.
So like if you're struggling to lift your foot without squeezing your toes, you can lift your foot and then work on relaxing your toes.
Yeah, without losing the position of your arch. I like that. Okay, so what John's gonna do is he's going to let himself then come back to a relaxed position, and then he's going to lift back up. Now, the one thing though that I want you to think about is when you go back into that relaxed position, you're not intentionally trying to drop that arch, right? Because like if people will go too much into falling through their arch and actually kind of exaggerating it, you're going to be complaining then of like knee pain or something else. So remember, you're just going back to your neutral position, like your normal, how you would stand, and then you're going to actively try to lift that arch up. You're not trying to press that arch down into the ground.
Exactly. We're going to do 10 repetitions of this on each side. One side might be more difficult than the other. If you have a hard time not gripping with your toes like I do, you can not just keep gripping, but as you're working on getting better, wiggle those toes a little bit, make sure that you have contact on all those points, but then still bring that up. This is pretty good. Would you agree?
Yeah, this looks even better than the first one.
Yep, and then I'm relaxing. And my relaxing is just going to my neutral. Eventually, my goal is to be more here, even though this might be a little bit more of an exaggerated position because I'm kind of strength training in it. However, I'm going to come out and I'm going to come back. And you're going to do that for 10 reps on each side and as part of the circuit.
When doing this motion, sometimes what I've seen is people try to get their whole leg involved because they're really trying to exaggerate that motion. So they'll start turning their knee out, kind of moving their hip and their whole body, and kind of doing this like jerking motion. You're really just trying to isolate this movement coming from the arch. So it's going to be pretty subtle at first, especially if your body's just not used to this. Just think of it as like just the tiniest bit of movement. You might not even necessarily achieve it right away. It's just a matter though of beginning to isolate that area. We're not trying to do anything where then we're trying to get that whole leg involved.
As I lift my foot, my knee will shift a little bit, but I'm not leading with my knee.
Right, the initiation should be coming from the muscles in the arch or the attachments of the tendons in the arch, not necessarily from the knee and the hip. I've seen that people will, your body just wants to do what it's seeing done here.
Yeah.
So then it's going to try to recruit whatever it can. So really be mindful about exactly how you're initiating this movement.
Right, so those of you who maybe have done some like powerlifting or weightlifting in the past, you're not like corkscrewing your leg in through your hip, spreading the floor with your toes, correct?
Right.
Like that is like a common cue where we're trying to like engage our hips. That might feel like a similar thing, but we're actually just isolating only from the foot as best as possible. So don't exaggerate from your glutes, don't corkscrew. All right, so we're on to the third exercise, which is going to be a tibialis posterior strengthening exercise. This was the one that I was excited about because often we're focused on tib raises, but the tibialis posterior is not actually raising or dorsiflexing, it's plantar flexing. And it is the most important muscle for forming the arch on the inside of your foot. If you were to sever your tibialis posterior tendon, no matter what you did, your arch would just drop.
The reason why it's so important that we focus on this posterior tib is that the posterior tib tendon actually kind of like splays out, and it has multiple attachments to multiple tarsal bones and even the metatarsal in the bottom of the foot, whereas that anterior tib does not.
So what we're going to do is I'm seated up. You could be seated on the ground, that'd be fine. And we're going to use a resistance band. TheraBands work really well. Thank you. The main thing you want to focus on is it shouldn't be such a strong resistance that you actually can't do the exercise.
Yep. And in terms of placement of where this band is, John's placed this right on the bottom part of his foot, like where his toes come into the rest of the foot, the metatarsal heads. But he's not putting it through the arch, and he's not putting it over his toes. So just right in between.
We're going to do 15 repetitions on each side. And again, one side might feel more or less difficult, but that's okay. That's why this is going to be part of a month-long challenge for yourself, and you're going to do this every single day, once a day.
Just to go over the motion of what the posterior tib does, it plantar flexes and inverts. So that means I point my toes down and in. That's plantar flexion and inversion. The band is going to act as resistance to that motion. John is actively trying to point his toes down and in, and then he's pulling back on the band, pulling it back and out to the side. So that's eversion. He's pulling that back to resist that motion.
That's right. So with this band, I need to get it a little bit higher. Perfect. So I'm going to point down and in. You could find that depending on the kind of band you have, if you could wrap it around the foot differently, so that way you feel like it is staying better on your foot. Mm-hmm. But generally speaking, you're just trying to get resistance against this motion. So I'm going down and I'm bringing my foot in. So pointing down and then in, and you're going to do 15 repetitions of this on each side.
What John's also trying to focus on doing is making that motion pretty smooth. If you can see, as he goes down and comes in, the motion is a little jerky. This will get better after the challenge.
You're a little jerky.
This will get better. This is an opportunity for improvement. That's what I always say. So the thing is that it's a little jerky right now just because that muscle just isn't used to working as much. So be really deliberate about what you're doing. So take your time going down and coming in. And same thing when you release that, don't just let your foot fly back, because there is benefit to slowly controlling that motion as well.
When you're all done, make sure you retest. Maybe in weeks 2 or 3, you should start to see a difference in how you're finishing. And even in obviously the pre-test, you'll see a difference too.
If you really want to make a change, consistency is key. So I really encourage you to make this a part of your daily routine, because that is the way that you end up improving that flexibility, stability, and strength, and retrain your brain how to position your arch.
If you want to get others involved, we strongly encourage you. This has been fun in the past. We're going to tag some of our friends. You could tag Mobility Doc in your stories every time you do the challenge. Show us your before and your after. Maybe show us some funny outtakes of your exercises. Put us in there. Let's get everyone doing this. Thanks for watching.